October is Breast Cancer Awareness Month, a reminder of the importance of early detection. Here's more on the symptoms, diagnosis, and treatment. Raising awareness against breast cancer is vital. Early detection can potentially save a life.
Getting mammograms and every year staying on top of that means if you're going to get breast cancer, hopefully we can catch it earlier when it's much easier to treat, cure, and it's a lot easier on the patient.
But what are some things people can do to stay healthy and detect breast cancer early on?
Self-breast exams, number one. Always keep a good eye on your breast to know if there's any different change in the breast. A lot of people say do your breast exam once a month, which is what they recommend, but I usually say daily. That way you know exactly if there's a change. Doing mammograms yearly, and that usually starts at age 40, and you come in every year and we do a mammogram and hopefully not see anything. Other people do other testing such as ultrasounds of the breast or MRIs of the breast.
According to the Texas Department of State Health Services, breast cancer is the second most common cause of cancer death among women in Texas.
Being diagnosed with breast cancer can come at any age.
No matter the age, breast cancer can affect anyone.
It can be as early as your 20s, which people are not very aware of, as well as, as long as someone can live. In the 90s, I think we've even had someone that was 100 that's been diagnosed.
Dr. Snuggs says 1 in 8 women get diagnosed with breast cancer and 15 to 20% are hereditary. That's why it's important to be aware of any symptoms.
If you notice any sort of change in your skin, whether it's redness, whether it's pulling in or what we call retracting, also you might look for nipple changes like discharge or redness or when your nipple actually pulls in as well. And probably the most common that you see is a lump. When someone feels something in their breast that doesn't feel quite right, it's new, they all definitely need to call their doctor.
There are several treatments available to treat breast cancer.
Probably the most common is surgery and followed by radiation, and that's usually in people that have smaller cancers, earlier cancers, not quite as aggressive, and that's another reason we want to diagnose them early. If someone has more advanced cancer or more aggressive type cancer, then they may end up with mastectomies, which is removal of the breast along with chemotherapy.
To learn more information on breast cancer, visit our website at foxwtx.com. Esmeralda Perez, Fox West Texas.